Okay, we're back. We're back at a ruckus crowd here at the CHNC. But so glad for us to have Beverley Brozanski and Anthony Piazza in the recording studio. Now, before we get into the QI, which is what you sat down to talk about, you guys have been a part of the CHNC like from the get-go. So tell us a little bit about that experience, longitudinal experience of being a part of something like this.
Well, Bev's been longer than I, so I'll let her be.
Well, I think the most important thing for me is that we're looking at patient outcomes and we all gather together to figure out how we can make our patients better. And it's all about small groups of patients at the local center that we can't improve upon because it would take us, years. So it's gathering everybody together who has the same pet population, and it's kind of like in the solution for patient safety. I'll teach, I'll learn. We want to learn what you're doing so we can improve. And everybody's so selfless. And I think it's one of the most selfless organizations that I've never been associated with. It's not all about me or the next investigator. It's all about the collaborative we to improve patient care.
Love that. Just thinking about this, two things came to mind. One was I'm going to get it wrong, a saying that Jackie had said at one of her retirement dinners is, we work as clinician in front of one patient, but the organization and what we should be thinking about how to do better for all patients. And I really feel like the clinicians here get that, and that's what we're trying to do. The other thing is I've always been impressed with this organization about uplifting trainees and junior faculty and having a ability for them to develop their career and advancing their career. I think both of those things kind of have resonated with me throughout the years of working with CHNC.
I love that. And I think people, the minute they walk in here, they can sense that, I think for trainees, especially like you said, conferences can be like quite intimidating. But it doesn't, this is such an inviting place that says like, we want to hear your thoughts. We want to include you. We want to support you. I think that's tremendous. It's one of my favorite things about coming to the CHNC symposium.
One of my fellows is doing beyond the main stage, it's representing the BPD focus group. I'm like, what a super privilege. Yeah, it is. Yeah. So
I love that. So, yeah, we brought you on to talk a little bit about the QI initiatives. I wonder, like your perspective, how has that changed over the decades of the CHNC?
Well, I think from the very beginning, we had such an interesting beginning. So as we were all together trying to develop the benchmarking fields, we knew that we wouldn't have data for several years. Right. Like we had to get people to collect the data. We had to have people analyze the data. Then we had to report the data, and then we can benchmark, right? So we all were worried that maybe our executive leaders wouldn't continue to sponsor us. So we thought maybe we should do a QI project. And that's how it got born. Several of us went to some trainings, and that's then there was the first collaborative.
Feels very grassroots.
Yeah, very grassroots. And
What was the first project?
prevention of central line associated bloodstream infection. We are still working on it, and I think so. If I can use that just for a moment, Anthony, to kind of break into the data piece, we have said that as one project finishes and we start another one, that we need to share the data from the previous projects over time so that we don't fall, and that we can, if somebody wants to say, okay, let's look at CLABSIs, we have all of our metrics, our clinical practice recommendations, but then we don't have the data over time. So then you can drill down on the data over time and see who's doing well. And so that's the beauty of what we're about to embark on, so that we can see past efforts and move and continue to move the needle forward.
yeah, I think we've learned as an organization that going back to what QI is about is data over time. our portals that report out a lot of our data are pretty stagnant, but they serve a purpose for benchmarking and for, see where you are as some of the quality metrics. But we didn't have the ability, or at least the sense, to look at it over time. And so now we've kind of regrouped and developing more platforms to show that data, which is really how you should look at quality and comfort.
I love that. And you've been alluding to the CHND, so the Children's Hospital's Neonatal Database. So tell us about the database. Yeah. What makes it so useful? How do you keep the inputs, quote unquote, clean, as we like to say?
I think a lot of it is the excellent data, the data abstractors. They do a incredible amount of work that's very important for the data. I mean, good data is only as good as you put into it. So we really are relying on them and their efforts. There's a lot of ways to access the data. Some are easier than others, and some are more important for local data as opposed to big database data. So there's ways to access it different ways.
Well, you asked about change over time. We developed these data fields like 15 years ago, right? So we're learning things over time, and we're committed to making changes in the individual data reports, so that the data inputs, the variables, so that they're more relevant to the new population. For example, when there's changes in surgeries for different diseases like gastroschisis, we want to be able to be able to plug that into the database and see the changes over time. So we kind of, make our data team crazy, because then they have to figure out how to adjudicate the new data fields with the old data fields.
Right.
So, but it's all learnings, and it's what we signed up for, and it's a lot of volunteer time.
Part of our registrants, a large part, are the data coordinators. They have their own working sessions and whatnot, but they get so excited to see the data presented on main stage, or the smaller working shops, or the presentations, and it brings them satisfaction just as much as the excitement that we see for ourselves.
And we've learned over time to include them in all the projects, right? Because they're the ones who know where they're getting that point. We don't necessarily know. So it's really all about the frontline team, whoever that frontline team is. And if you can keep that in as a leader moving progress forward, then you're gonna be successful.
It sounds like you guys have been so intentional about not only building data tracking, data dissemination internally, and now involving stakeholders within internal. Is there any activity, any work around how you guys will disseminate this work that you're doing outside the CHNC? Because there's so much to learn about your intentionality and what you're building in terms of data in general and data tracking over time. The world should know.
We'll put ourselves out there for any invitation. We just got an invitation to NeoHeart for 2026. Yeah, we are ready to spread the word.
Ready to travel around and talk.
I think locally we spread quite a bit. Like one of our projects was perioperative handoffs. That was NICU kind of focus, but it quickly spread, at least in several centers, into the CI and to the PI, and they use so locally. I think there is a lot of spread.
I agree, and as Anthony pointed out earlier, we're spreading by pulling young faculty into the fold so that they're excited about it, and then they spread that to the teams at the local level.
So that's a call to action, right? To our listeners who are early in their career.
Yes, sir. Call to action. Yes.
Well, we're asking everybody. I know as soon as the conference is over, you're already thinking about what's coming next. So what have you been looking forward to all year about this symposium?
It getting here.
That's right.
All the hard work. It's also a great way to network. For Anthony and I, who've trained quite a few fellows over the years, it's quite nice to see, right before we walked over, to see, a couple of fellows that did train with me actually in Pittsburgh before I moved to St. Louis. And it really is so nice to see that, and to realize that they're neonatologists in a big institution and have families, and we're growing the next generation. So it's nice to see that here.
I'm actually a pretty emotional person. And last year I had a very heartfelt meeting with one of my former fellows, and this year as well as a current fellow, and just seeing them progress in their careers is really amazing, and that's what we see here.
Fills our cups. And then and that they're grateful. So I always say, well, then pay it all forward, right?
Yeah, I love that. And I mean, I think he's bringing up such an important point about conferences in general, like being able to engage with one another in a non-clinical setting, I think is a totally different opportunity to connect and feel seen and be heard. And I think that's so special. Yes. Well, thank you all for creating a space for that. Thank you so much for the work that you have done and that you're continuing to do.
And right back at you. Thank you.
Yes, and thank you for being here.
Yeah.
That's great. Yeah.
Our pleasure. It's our pleasure. We've got a lot more interviews coming up.